Welcome to this explainer. Right now, as we're talking, there is a tiny butterfly-shaped gland weighing literally less than an ounce that is dictating the pace of your entire life. Today, we're exploring the body's master engine, the thyroid gland. We're going to look at exactly what happens when this absolutely essential engine runs way too hot or when it just completely stalls out. But hey, before we dive into the heavy science and all these cellular mechanisms, I want you to think of the thyroid like a car engine. In this explainer, we're contrasting two drastic extremes. On one side, imagine a stuck accelerator. Your heart is racing, you're dropping weight like crazy, and you are constantly overheating. On the exact opposite side, we have a dead battery. You're feeling incredibly sluggish, gaining weight, shivering. It is wild to think that these microscopic hormone shifts can completely redefine a person's day-to-day reality. So here is our roadmap for today. We'll start with the balancing act, move into life in overdrive, follow that up with the great slowdown, and wrap things up with diagnosing the imbalance. All right, part one, the balancing act. Let's look at normal thyroid function. Okay, take a look at this breakdown. Notice how these symptoms perfectly mirror each other? It's like a physiological seesaw. In a hypo state, your body temperature drops and you gain weight. But in a hyper state, you can't tolerate heat at all and you're losing weight despite having this ravenous appetite. It's a perfect inverse reflection. And it affects everything, from your central nervous system right down to your cardiovascular system. A sluggish thyroid leads to depression and really slow reflexes, whereas an overactive one, that causes agitation, anxiety, and tremors. Even the heart rate flips. Hypothyroidism gives you a reduced pulse, while hyperthyroidism drives severe tachycardia and arrhythmias. Moving on to part two. Life in overdrive. Let's dig into hyperthyroidism. So when those T3 and T4 levels spike excessively high, a patient's basal metabolic rate basically goes through the roof. We see the cardiovascular and gastrointestinal systems go into total overdrive, increased heart rate, higher cardiac output, and frankly, frequent bowel movements. On a normal muscular level, this translates to tremors, profound nervousness, and hyperbrisk tendon reflexes. The body is essentially trapped in this exhausting, constant state of fight or flight, all fueled by an absolute overflow of hormone. So you're probably wondering, why does this overdrive actually happen? Well, the most common culprit is an autoimmune condition called Graves' disease. Think of it as a cellular hijack. Normally, your pituitary gland sends out thyroid-stimulating hormone, TSH, to tell the thyroid to get to work. But in Graves', these rogue autoimmune antibodies perfectly mimic TSH. They bind directly to the receptors and trick the gland into this abnormally high, totally uncontrolled production of T3 and T4. The body's built-in off switch is, for all intents and purposes, completely broken. And this hijack leads to some pretty intense physical transformations. On the left here, we have exophthalmos. This is a severe bulging of the eyes caused by tissue swelling right behind the eyeball, and it's often accompanied by a really pronounced lid lag. Then on the right, pretibial myxedema. This presents as distinct, swollen, non-pitting edema right on the shins. I mean, these aren't just vague, invisible metabolic feelings, right? They are profound physical changes driven entirely by those rogue antibodies. Now, we absolutely have to talk about the extreme end of this spectrum, a terrifying medical emergency called a thyroid storm. This happens when an abrupt stressor, say an infection, a surgery, or even just stopping medication cold turkey, causes the engine to completely overheat. We are talking about a fever rocketing up to 104 or even 106 degrees Fahrenheit, a heart rate soaring past 140 beats per minute, severe agitation, delirium, and eventually, if left unchecked, organ decompensation and coma. It is the frantic, life-threatening peak of thyrotoxicosis. All right, let's flip the script. Part 3. The Great Slowdown, otherwise known as hypothyroidism. What happens when those T3 and T4 hormones drastically drop? Well, the whole body basically shuts down to conserve energy. Imagine the heavy burden of this. You've got profound mental slowing, apathy, and just this overwhelming tiredness. Physically, patients experience cold, dry skin, a pale, puffy face, and this is a classic sign, the loss of the outer third of their eyebrows. The heart slows down into bradycardia, the gut halts, which leads to severe constipation, and the patient suffers unexplained weight gain, even though they barely have an appetite. Everything just grinds to a halt. So what actually triggers this massive system failure? While Graves' disease overstimulates the gland, primary hypothyroidism is usually about destruction. Take Hashimoto's thyroiditis, another autoimmune disease. Here, T lymphocytes and autoantibodies literally attack and destroy the thyroid cells. But globally, a massive culprit remains simple iodine deficiency. Without iodine, the body literally does not have the raw materials to build thyroid hormones. We can also see congenital issues in newborns where the gland just doesn't form right, leading to severe developmental delays if we don't catch it immediately.
Let's look at iodine deficiency specifically, because it creates this tragic yet fascinating physiological feedback loop. Step 1, there is no iodine. Step 2, because there's no raw material, hormone release just plummets. Step 3, the hypothalamus senses this drop and starts pumping out more TRH, basically sounding the alarm. Step 4, the pituitary screams at the thyroid by pumping out massive amounts of TSH. And finally, step 5, receiving all this constant stimulation but lacking the necessary raw materials to actually do anything, the thyroid tissue just grows and swells. This results in a massively enlarged neck, which we know as a simple goiter. Just like the hyper state has that explosive thyroid storm, the hypo state has its own terrifying extreme, the myxedema coma. This is the devastating, life-threatening endpoint of extreme hypothyroidism. It's often triggered by an acute illness in someone who already has a failing thyroid, and the body simply gives up. Body temperature drops dangerously low, severe confusion sets in, the heart rate plummets, and breathing effort is severely reduced. It's a quiet, deadly fade-out of the body's major systems. Which brings us to part 4, diagnosing the imbalance. How do we find the root cause? Visual diagnostics here are just incredible. By giving a patient a safe, radioactive form of iodine, doctors can literally see how hungry the gland is on an uptake scan. I mean, the thyroid normally uses iodine to make hormones, right? But in conditions like Graves' disease, the scan absolutely lights up. It physically proves the diffuse hyperactivity, as the gland ravenously absorbs iodine across all areas to fuel its hormone overproduction. But, the ultimate puzzle solver, the real diagnostic gold standard, is the blood test. Interpreting the exact inverse relationship between TSH and free T4 tells us everything we need to know. Look at primary hypothyroidism for a second. TSH is screaming high, trying desperately to stimulate the gland, but free T4 remains low because the gland itself is broken. In secondary hypothyroidism, the problem is actually up in the brain. TSH is low, which directly causes the free T4 to be low. And in hyperthyroidism, high T4 suppresses TSH to almost zero. The blood doesn't lie, guys. It points exactly to the broken link in the chain. It's honestly mind-blowing when you take a step back and realize that our energy, our mood, our heart rate, and even the physical shape of our eyes are tethered to these microscopic hormone levels. A fraction of a millimeter change in a blood test is literally the difference between crippling sluggishness and heart-racing anxiety. So it really makes you wonder, if such microscopic chemical shifts dictate our entire reality, how much control do we actually have over our own physical and emotional human experience? Keep that in mind next time you're feeling a little off. Thanks for joining me for this explainer.